Good evening, guys. Today's discussion is this page discusses the progression of dementia and the signs that indicate when a dementia patient may be approaching the end of life. It explains that dementia progresses through stages: mild, moderate, and severe, each affecting a person's ability to perform daily tasks. The functional assessment staging tasks is one common tool used to track Alzheimer's progression. In severe stage, patients struggle with basic activities like eating, moving, and maintaining hygiene. The page likely outlines key signs that suggest death may be near. Through these details aren't fully visible in the content I reviewed. Dementia progresses through several stages, each affecting cognitive and physical abilities differently. While some models describe these broad stages: mild, moderate, and severe. Others, like the Global Deterioration Scale, or GDS, breaks it down into seven stages. Number one, no cognitive decline, no noticeable memory issues or cognitive impairments. Two, very mild cognitive decline, occasional forgetfulness, such as misplacing objects or forgetting names, but nothing that disrupts daily life. Mild cognitive decline, increased forgetfulness, difficulty concentrating, and trouble finding the right words. Close friends and family members start noticing changes. Moderate cognitive decline, uh, clear memory loss, difficulty managing, finances or traveling alone, and trouble recalling recent events. Moderately severe cognitive decline, assistance is needed for daily activities like dressing, memory loss extends to personal details like phone numbers. Severe cognitive decline, significant memory gaps, difficulty in recognizing loved ones, and loss of bladder control. Assistance is required for most activities. Okay, 7, very severe cognitive decline, loss of ability to speak, walk, or control movements versus the other thing is patients require full-time care. Stage of dementia presents unique challenges for both individuals and caregivers. Here's a breakdown. Early stage is mild dementia, guys. Memory lapses, forgetting recent uh, conversations, or misplacing items. Difficulty with problem solving, struggling with complex tasks like finances. Mood changes, increased anxiety or depression, social withdrawal, avoiding conversations or activities due to frustration. Okay, middle stage is moderate dementia, increased confusion, difficulty recognizing familiar places or people. Language struggles, trouble finding words or following conversations, behavioral changes, aggression, let's see, agitation, aggression, and wandering, challenges with personal care, dressing, bathing, eating may require assistance. Late stage, severe dementia, significant memory loss, may not recognize loved ones, limited communication, difficulty speaking or understanding, physical decline, loss of mobility and control over body functions, complete dependence requires full-time care for daily activities. Would you like advice on how to support someone through these stages? You can also find the details at msn.com, guys. Managing dementia related changes requires a combination of environmental adjustments, communication techniques, and personalized care strategies. Here are some effective approaches. Creating a calm environment, maintaining a consistent routine to reduce confusion, minimizing noise and distractions to prevent agitation, using soft lighting and familiar objects to create a sense of comfort, effective communication. Speaking slowly and clearly, using simple sentences. Maintain eye contact and use gentle touch for reassurance. avoid avoid correcting or arguing, redirect conversations instead. Managing behavior changes, identify triggers for agitation or aggression and adjust accordingly. Engage in soothing activities like listening to music or gentle exercise. Ensure basic needs, hunger, pain, or discomfort are met. Supporting daily activities. Use visual cues, step by step instructions for tasks. Engage, encourage independence while providing necessary assistance. Adapting, adapt clothing and un, utensil to make dressing and eating easier. 5. Caregiver well-being. Take breaks and seek support groups to manage stress. Practice self-care to maintain emotional resilience. Stay informed about dementia progression and care techniques. You can find more detailed strategies here and here. Would you like advice on specific challenges you're facing? Many of the strategies used for dementia care can also help manage other cognitive changes, such as ADHD, traumatic brain injuries. And age-related cognitive decline. Here's how they apply. Cognitive engagement, brain training exercises like puzzles, memory games, or learning new skills can provide focus and problem solving. Mindfulness meditation enhances attention and emotional regulation, benefiting individuals with ADHD. Environmental adjustments, reducing distractions, quiet spaces, structured routines help those with attention difficulties focus more. Reducing distractions. Using visual cues and reminders supports memory and retention in individuals with cognitive impairments. Behavior management. Identifying triggers for stress or frustration can help manage emotional responses in various cognitive conditions. Engaging physical activity improves brain function and mood. Communication techniques break down tasks into smaller steps, aids those with executive function challenges. Using clear, direct language supports individuals with processing difficulties. Would you like strategies tailored to a specific cognitive challenge? You can explore more at msn.com, guys. Dementia care strategies can be broadly categorized into non pharmacological approaches and traditional medical therapies. Here's how they compare: non pharmacological strategies, personalized care, tailored routines, environmental modifications, and cognitive engagement activities. Behavioral intervention techniques like validation therapy and reality orientation help manage confusion and distress. Holistic approaches, folks. Musical therapy and autonomic therapy and sensory stimulation can improve mood and reduce aggression. So that is A for this afternoon or evening. I will see everybody later for B and C. See everybody later for B and C.